Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Welcome. Sarah Wittry is a hospice and palliative care physician, wife and mom of 4. Having navigated challenges like infertility, adoption, anxiety, and burnout as a physician mom, Sarah is deeply committed to empowering other professional moms to reclaim their time, energy, and joy. Through her platform, Vibrant Humans, she helps women define what it means to be a good mom and professional, guiding them to set healthy boundaries and prioritize their core values. Her mission is to support women in creating a more vibrant, balanced life aligned with what truly matters to them. Welcome, Sarah.
Thank you, Jessica.
So it's a pleasure and a gift to learn from your experience today and just talk about emotional awareness and how to create that life in alignment with our core values.
Absolutely. Absolutely. Very important stuff.
I'd love to know if you could tell us a little bit about your journey and how you got to doing the work that you do.
Yeah, absolutely. So I'd say that growing up, I was always the type of person that liked to ask the deep questions. Like in Truth or Dare, it was always the truth, like, tell me more, tell me more. And that's something that's definitely followed me throughout my life and been a part of who I am. And so I think that I combine that with kind of this deep desire of curiosity, intellectual curiosity, knowing more. Also, some unhealthy patterns developed, like striving for excellence always at all costs, right? And then, pursuing a career in medicine, I think was a good fit in some ways and another fit because of the culture of medicine and kind of how it prioritizes the patient and the system and the productivity and all of that. It became really challenging for me to reconcile some of that, wanting to have those really deep connections with patients and the people I was working with and kind of be authentic and be transparent. And I just think that I was chasing what I thought was what was needed from being in medicine and everything, and kind of lost sight of myself for a while. And so all the perfectionism tendencies and people pleasing and all of that, I felt like drew me away a little bit. And then through a lot of things in medicine and career, as well as like family life and personal life kind of intertwining as they do. I think it's been a journey in the past decade, honestly, of rediscovering who I am at the core, my authentic self, who Sarah is, and how I want to show up in the world. And so that's the big picture, the zoomed out view of my journey and what I'm passionate about and who I am here to serve today.
I want to thank you and honor your sharing, especially on so many years of experience. And it's interesting in medical practice, especially, there's so much intense critical illness, and especially as a hospice and palliative care physician, dealing with life and death and those tough conversations all the time. And, in some fields, not even having time to process the conversations you're having or what is the meaning of life, let alone talk about death. And I know you said you've been on this journey for a while now. And I
Mhm.
guess, what did you find to be the point where you're like, I needed to make a change?
Yeah, I would say there were several, but almost like each time I added a new layer of identity, like became a spouse, became a mom, like those times were really big inflection points for me in my life because it was like when you're only taking care of yourself in like medical school and stuff, your focus can be on just working and knowing and understanding and studying all the hours and really not taking care of yourself very well. But most people, I didn't take very good care of myself during medical school. But yeah, as you like added responsibilities for other people and that what your core like that really matters to you, right? That you're um present, or at least for your family and kind of what you want those relationships to be. I just had these like different realization points of like, this is my life, it's happening, right? And I think that, yeah, definitely as I got into working in palliative care and hospice and having those conversations with people all the time and learning and like training in those communication skills and how to like draw out those deeper things in people, it became pretty apparent to me is like a catalyst for my own self-reflection and being like, how am I doing this in my own life? Right. And I don't want to delay the life I want to have for later all the time because I'm, busy and I'm too, yeah, I have too much going on to even like have time to think about it. You know what I mean? So it's like, I think it's been an ongoing process of like different stages and different levels of depth in kind of that self reflection.
I also resonate very deeply with what you mentioned about every time you added a new layer of identity to
Mhm.
yourself and uncovering that process of what is your core values. It's not easy to do, let alone when you're working full time, forget medicine, any other field. And especially for coaches, for those listening to it or thinking about transitioning careers, when you have your busy schedule and everything going on, how can you support yourself in figuring out what your values are? Does
Yes.
that mean taking time off? Does that mean stopping everything? Most people, it's hard to mentally and emotionally make that jump, let alone be able to financially do that and support yourself. So I guess as you were going through it, what did you find to be most supportive to you to be able to work on this path as you were living your life?
Yeah, yeah, that's a great question. I think what probably stands out for me is like the awareness that it was important and like really important. One of my values is self growth. And I think it always has been in some ways, but definitely, like you said, it gets covered up because there's not time for it, like in your busy, crazy life, right? So it's like, yeah, awareness that it was really, really important to me, as well as shifting how I thought it needed to look. So I think when I first started being like, oh, there's some red flags here that things are not like lining up with who I want to be or how I want to live my life, I thought, well, I have to have like all this time, like weeks off, of sabbatical. I have to take a year off. I have to like, have all this space. And it didn't seem practical or possible or feasible. So I had to change how I thought what that needed to look like. So it became rather than an hour block or a half a day or something like that, it became like listening to a short podcast on my way to work or, you know, like what I was taking in, I think listening to, reading, that kind of thing, even in 10-minute chunks became a lot of like how I followed those little breadcrumbs of kind of what my heart, my soul was really craving and desiring. And so like honoring that it's going to be short amount of time and also that it still really matters.
To be able to have that intrinsic motivation, to be able to take that 10 minutes that you have and realize, no, I can still use these 10 minutes and it will make a difference rather than not to do it at all. I'm curious, you had mentioned that there were some red flags at the time where you knew it was important to you. Are you okay sharing on what some of those red flags might have been, what those warning signs were?
Sure. So I remember really well some vivid memories in residency where I'd be talking with my co-residents, and I think a lot of the narrative and the culture was that we were to be at the hospital all the time and get there as early as possible, leave as late as possible, and then study as much as we could on our off time. And I think even early on, that was a big red flag for me because I was like, well, that doesn't lead to any sort of balance as a human, right? Like I have all these other interests. I also just want to have time to cook. I want to have time to go outside. And I lived in Seattle and it was a beautiful city. And I wanted to like explore and go hiking and, just see other parts of life. And so I remember, yeah, feeling like I was alone in that though, like that other people said, yeah, that sounds nice, but we can't, right? We're in residency, we live at the hospital. If you're not fully dedicated in every minute of your day and week, you are not a good resident. Like you don't care is kind of the message that I got. So I knew deep down that that wasn't accurate, but it was hard to feel kind of alone in that. It didn't feel right to have my entire life, I guess, dedicated to one part of me. So that was a really big red flag, just like, oh, I don't know if this is for me, right? Like culture of medicine wise and what it takes to become a doctor and kind of that identity. And then, yeah, same thing with parenting and becoming a parent, right? It was mainly like there were lots of things. Like it's interesting because it's kind of both ways. It's like as a parent and as a doctor, there's so many narratives that kind of get you absorb and take on. And so I didn't want to believe either that when I was working or when I was doing some other activity or with my friends or like some other aspect of my life and not with my kids, I didn't want that to be like, you are a bad mom. You don't care about your kid enough. They're going to have all these things happen because you weren't with them 24/7. And yeah, it was kind of figuring out for myself in different ways at different times, not like a one and done thing, but over time realizing like that doesn't seem true, right? And I think there's another way, but I have to figure out how to discover that for myself and what that means.
It's really difficult when you're in it to realize a social or organizational, in this case, a professional narrative, that culture of medicine. And when you dedicate your whole life, that happens so often in corporate culture too, you dedicate most of your waking time to this life. And the constructs imposed on us by the environment we're in just don't align with who we are as human beings. And so then it's like, where do you go from there? How do you navigate that? Do you redefine the narrative? And how do you redefine the narrative while staying in the same environment?
Right. Totally. Totally. It can feel really daunting, if not impossible at times, right? As you're kind of starting to challenge that.
Yeah, and I'd love to know so much of burnout, right? It's now more openly spoken about than it was 10 years ago when we were training. And it's nice to know because I felt that myth that it's just me or maybe I'm not good enough or it's personal when in reality it's the organization. It's 100% the system. Or maybe there's an individual component, majority is the organization the way it is. And
Yes.
so, outside of changing the organization from systems change, what did you find that you had to do to reconstruct your own narrative?
Yeah. You mean within medicine, right?
Yeah, and how did you figure out that alignment, like what that path looked like for you while you were in the same environment?
Yeah. Well, I think that what drew me the most into the field of palliative care was being able to have those, even though really difficult conversations, right? Where there's a lot of emotional intensity. It was the area of medicine that I saw as the field where humanity is still at the top and it's still a cornerstone. And it's like you can't have that field, I don't think, of medicine or that subspecialty without humanity, deep connection, and holding space for people. And so I think, yeah, I had the reckoning. 'Cause I did training in rehab medicine and I had a lot of other interests, but I was like, if I'm going to stay in medicine, this seems hard. I wouldn't necessarily sign up or pick it, out of because it's hard, but also it's the area that I feel like I'm going to be able to bring myself to, like, more of my authentic self and be able to connect with people in that way, even though I'm still operating and working in this system that is not always aligned with the same same motivation. It doesn't always see the same things as, like, valuable. So that was one thing was just, like, really being true to myself in terms of what I ended up choosing. And then I think I've had to take a pretty deep look in terms of, like, what elements do I need to have? What's non-negotiable for me? And then what is like would be nice if, or what little areas do I have a little bit of say in and a little bit of autonomy in. So for me, a big thing is feeling a sense of freedom and flexibility with my time and kind of how I construct things. And so I've over the years been able to construct a little bit more of that for myself. A little bit was reducing my FTE. A little bit was prioritizing like wellness and having that as an initiative that I help with our faculty. And having that baked into my job description helped a lot because it's stuff that I'm also passionate about doing and I'm able to do at work and have dedicated hours to it. And then I think that for me, it's like a lot of intentionality behind knowing my core values, being really aware of them, and then day to day and week to week, using it to check in with myself and like, what do I really need? I need some colleague connection. That's what I'm craving. That's what I need, feeling kind of down or whatever. So then I will intentionally plan a couple of short break coffee walks or something with people that I trust and care about and want to connect with. It sounds kind of small, but those little tweaks I feel like are what's helping me to be able to stay in my career, to feel like capable of being myself and also operating in a system that is not built for wholehearted humans.
That's a nice way to say it. Yeah, so it sounds like there's so many different strategies that you used and techniques and approaches. And the first was really having that self awareness to honor and acknowledge those red flags, realizing there was that discord with your environment and your values and your whole person and what you wanted out of all elements of your life. And once you realize that, like you said, just taking those baby steps, embracing that autonomy, that self determination, that agency to make the changes you can, and honoring the field of medicine where you actually felt like you were contributing and having that fulfillment and value of all those noble ideals in medicine that maybe once were in another time.
Absolutely. Absolutely. And I think that entrepreneurship also brings in an element. A lot of times it's what you see is lacking and what you're like, there's a gap. I could do this better. I could imagine how to do this better. And so that's helped too in terms of helping others in coaching find more of their purpose and be more of their whole selves. That part is really valuable. And then also, I have ideas and I guess I'm more open to what other possibilities are out there in terms of helping people have more agency in their own healthcare, right? As patients and be able to kind of plan ahead. A lot of the stuff that we do in palliative care is the conversations we have are in crisis mode, right? Where people are already in the hospital, everything's already, the wheels are falling off. It's really heightened emotions. And so I have some ideas for how to structure things differently. And even if I have to go at it on my own, right? Be able to kind of have a grassroots effort in that way to kind of see where you think something could be improved upon. And if it doesn't work within your current system, go out on your own and do it. Find some other people that think it's a great idea too and start your own thing.
I love that. And thank you so much for making that connection and connecting those dots because one of the criticisms of the treatment for burnout is it's not just about resilience at all. But the thing is, short of systems change, which is slowly has to happen, each one of us is responsible for being proactive. And these little things, once we're able to find that fulfillment in ourselves, like most coaches also, usually they have a problem, right? And that's not being solved. And they figure out how to help themselves, how to empower themselves. And so then by figuring that out, what do? You create your own platform, you find your people, you serve people who otherwise would never be helped by that problem that you went through. And now it's not just you taking care of yourself and finding your fulfillment. It's contributing to your microcosm of home environment, your society, everything around you. It's just such a ripple effect that tends to happen.
Totally, totally. And I think that when physicians or people in healthcare are empowered, they can create these huge shifts or small shifts, right? But meaningful small shifts. And then I think one of the coolest parts is that when people watch you and they see you and they see you like these things you go through and change and shift, and even how you talk differently and how, like, what you believe, how you show up differently with a different energy, they're like, oh, like, it gets the wheels turning for them. Like, what's possible for me? And I think that's one of the coolest things I've seen, just in my own, group at a hospital. It's just that people are thinking outside the box for themselves because other people are modeling it for them.
Mhm. And then the more you do that, the more you find other people who are thinking outside the box. It's like a like attract like. So you finally start seeing all those possibilities that may have been around you in the first place, but you're just more aware of it now.
Totally. Yes. Love it.
And the other part about what you had said, you had talked about making those very stressful decisions on health and how you want to live in conditions of stress. And you said you had ideas of doing it when you're not in conditions of stress. And so, like for coaches listening to this, for anyone listening to this, just living our lives with that mentality of every day, kind of have what have I done, or having that kind of own self assessment that's been aligned with my values today. If something wasn't, is it acceptable to me or is there something that needs to change?
Totally. Totally. Yes.
I guess for someone who is looking to align their life more with their core values, coaches and providers listening to this podcast, Any advice or like tangible ways for them to get started, just in summary of everything that you've already said so far?
Yeah. So one thing that I think is really helpful and a tangible thing is if you have, huge list of core values, you break it down, you like go through, you really narrow it down, like 3 to 5, right, of your top ones that really resonate the deepest. And the more times you do it, I feel like you're more and more sure of it, or you're just really confident in what you choose. And then I think that a lot of core values are linked to feelings, right? Because it's like freedom or growth or adventure or like whatever it is, right? Being energized, feeling passionate, like all those things are values and feelings are so linked. And then what I recommend people to do is about like their top 3 values to write them down and then under each one brainstorm as many different things you can think of that help you to feel that way, right? So it can be like, I value connections, right? So things that help me feel that way, that can be like coffee dates. It can be connecting to like my neighbors, like having a conversation with a neighbor. It can be talking to a random person at the store. It can be planning a walk or a little park outing with one of my kids. It can be a date night, like all these things, big and small, right? You write down those things. You literally just brainstorm activities, small practices that help you to generate that emotion. And then you just start small. You choose one, you say, okay, I really value this. I want more of this, right? Because it matters to me. I doing it, and then you translate those like core values and kind of associated emotions, those states that they produce into like action items, right? And you sprinkle those in your day or your week. And then I think it's really important to also like reflect on them afterwards. And if you look back over the day or the week, you're like, oh, I'm so glad I spent that 10 minutes outside today because it really helped me feel more peaceful. It helped me settle my brain a little bit, whatever it was. And because if you kind of let that soak in, then it helps you recognize the impact of that little practice. And it also helps you feel motivated to do it again or something similar again, because you kind of see the return on your investment of time. And I really do think it's 1% changes over time. Like you know, 1% less of something today that you don't really like or enjoy and replace it with that 1% of something that you do. And that helps you cultivate those values. And then, yeah, little tweaks over time.
1% is such a nice number. Thank you for bringing that up. That is very tangible. It's interesting too, because the method that worked for you, like listing your values and letting that guide you, that resonates so deeply. One of the things I transitioning careers out of medicine is, or just making any pivot, whether it's in your field, just somehow. Obviously, it has to be guided from within. Otherwise, the grass is always greener. There's no guarantee on satisfaction in this new endeavor unless you are very clear from inside. And one of the things I promised myself was I'm only going to do works that I'm passionate about. It's
Yeah.
hard when you're passionate about so many things, but it's nice because when you anchor to those values and do baby steps, all of a sudden you start forming your own path, stone by stone. And it
Hmm.
just appears and it takes you to this place that you never could have imagined.
Totally, totally. And I think it's so important too, as you're like doing that journey, recognizing it's a journey and not an arrival, recognizing that you're going to have twists and turns and be open to unexpected things. I don't know how good you are at that, but I wasn't always good at that. I was like, well, this is the plan. Like, that's not on the plan. And so being open to that and also like really letting your emotions kind of help be your guide too, of like what when you're on the right path or when you veered off path, checking in with what's coming up for you and what your emotional state is day to day, because they give us really large clues if we pay attention to them.
And it's so important for us to listen to them because as we listen and like you mentioned, it's a journey, right? And it's an everyday journey. No matter where we are, there's always room for introspection, awareness, and reassessment of alignment. And the more we do that, or the more I've done it for myself, I can't tell you how it's impacted my ability to cultivate empathy
Yeah.
and actually serve the people that I want to serve in such a way that's authentic.
Totally, totally, absolutely. Because you realize when you're allowing yourself that grace, then you can allow it for other people too, because we're our own worst critics, right? So then, I don't know, like, I've had a tendency to even, like, be harsh on myself about how I'm doing on the journey and be like, "Oh, you should be further along by now," you know? And that's all kinda crap that we have to challenge and meet with compassion instead.
Especially in coaching, the inner critic, because for coaching, it's like this client-driven process with no predefined beginning and end, and it's just that person's journey, and they're
Yeah.
also trying to navigate their societal expectations, environmental expectations, and their own. And so really being able to hold the space to that and witness that is such a beauty.
Yes, yes, absolutely, absolutely, and really letting people find their own path, which I think is what a lot of coaching is, right? Is being a guide and a mentor, but also recognizing their journey is gonna look very different from yours. Their values are gonna likely be a completely different mix than yours, and, like, allowing that and accepting that without judgment or projection is so, so important, I think, as a coach.
Yeah, and it's amazing when you think about conversations and just interactions we have with human beings every day, our normal interactions. It's like that space is not often provided at all. A lot of people don't really know what coaching is or what the process of coaching is. And as coaches, even sometimes it's not so easy to explain it. It has to be experienced, even though we can do
Right.
our best to experience it. And that everything you're holding space for is so unique. And so to go through this, it requires us also having this awareness and walking that talk for ourselves.
Absolutely, absolutely, couldn't agree more.
Thank you so much for these insights. So, I guess just in summary, takeaways for coaches and providers listening to this on how to cultivate that emotional awareness and align their life with their core values.
Yeah, I think getting quiet time, like regular quiet time for yourself is huge because that's where you're going to be able to reflect and turn that lens inward, right? Of like what is going well, what feels off, and then paying attention to those desires, right? Like really at the end of the day, it's like we're led by emotions and desires and our values. And when we are aware of those and the big picture, but also kind of moment by moment, day by day, I think that is the secret sauce to like living in a way that is true to ourselves.
Beautifully said. And I love the 1% number that you gave that advice to 1% less of something maybe you're not too crazy about. My biggest takeaway is just to have that mindful presence always. And to also not have judgment. You know, your story of having that 10 minutes or whatever, utilizing the time that you do have and not even having judgment on ourselves or critiques on ourselves on the amount of time we have to do this because everything can have a powerful impact. We just don't know it until we do.
Exactly. Yeah. Yeah.
Thank you so much, Sarah, for sharing your journey and your valuable insights with listeners here.
Absolutely. It was lovely to talk with you.
Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.